Megan. I'm going to be your nurse today. Can you tell me your name?
Reagan.
Hi, Reagan. I understand you're here for a head, ears, eyes, nose, mouth, and throat examination today?
Yes.
All right, I'm going to give you directions as we go along, and if you have any questions, just let me know, okay?
Okay.
All right, I'm going to start with your head. First, I'm going to palpate your cranium. Do you feel any tenderness?
No.
All right, now I'm going to inspect your scalp, noting that it is clean, free of any redness, irritation, or infestation. And I note that your hair is a dark brown and it's thick. Now I'm going to move down to your face. First, I'm going to inspect the outer structures of your face. Looking at your eyebrows, your eyes, your nose and mouth are all midline and symmetrical. Now I'm going to palpate your frontal sinuses. Any tenderness?
No.
Your maxillary sinuses. Any tenderness?
No.
All right, now we're going to check your temporal artery. I'm going to palpate that. Now, while we're here, we're going to check cranial nerve number 7, which is your facial nerve. Can you open your mouth, close your mouth, and bite down? All right. Now we're going to check cranial nerve number 5, which is your trigeminal nerve. Can you smile for me, frown, and puff out your cheeks? All right. Now we're going to move down to your eyes. First, I'm going to inspect the outer structures of your eyes, your eyelashes and eyelids. They're free of any debris, any redness or drainage. Now I'm going to inspect your sclera, your cornea, and your iris. Your sclera is nice and white. Your iris is nice and brown. I'm going to step to the side, looking at your cornea, nice and brown. Now I'm going to inspect your conjunctiva and put it down on your eyes. They're nice and pink. All right, now we're going to check cranial nerve number 2, which is your optic nerve. Can you read this for me?
Alcohol prep pad.
All right. Now we're going to check cranial nerve number 3, 4, and 6, which is your oculomotor, your trochlear, and abducens. I'm going to have you follow my pen with your eyes. Try not to move your neck, okay?
Okay.
Look behind me and look back at the pen. All right. Now we're going to check your pupil reaction. Straight ahead. All right. Now we're going to move down to your nose. First, I'm going to inspect the outer structure of your nose. I'm looking, it's nice and midline. Can you tilt your head up for me? I'm going to inspect your nasal mucosa, which is nice, moist, and pink. And your septum is nice and midline. All right, now we're going to check cranial nerve number 1, which is your olfactory nerve. Can you tell me what you smell?
Watermelon.
All right. Now we're going to check the patency of your nose. Can you put one hand over your nostril and take a deep breath in? And let's do the other side. Any difficulty?
No.
All right. Now we're going to move down to your mouth. First, I'm going to inspect the outer lips. They're nice, with free of any cracks. They're moist. I don't see any fever blisters. Can you open your mouth for me? We're going to look at your teeth. We're going to look at your teeth, your gums, your buccal mucosa, your hard and soft palate. Pick your tongue up for me. All right, stick your tongue out for me. We're looking at your tongue and your tonsils. All right. Now we're going to check cranial nerve number 9 and 10, which is your glossopharyngeal and vagus nerve. Can you open your mouth and say ah for me? All right, now can you close your mouth for me and take a swallow? All right, now we're going to check cranial nerve number 12, which is your hypoglossal nerve. Can you stick your tongue out for me? Wiggle it side to side and repeat the words light, tight, dynamite.
Light, tight, dynamite.
All right, good. Now we're going to move back up to your ears. First, I'm going to inspect the outer structures of your ears. They're free of redness and drainage. See this side. All right. Now I'm going to palpate your ears. Let me know if you feel any tenderness.
No.
All right, now we're going to check cranial nerve number 8, which is your acoustic nerve. Can you put one hand over this ear, and I'm going to whisper something in this side, and let me know what you hear.
Cat.
All right, let's do the other side.
Dog.
Okay, now we're going to move down to your neck. First, I'm going to inspect your outer structure of your neck, looking for any pulsations. I don't see any, no lumps. All right, now I'm going to inspect your trachea. It's nice and midline. All right, now I'm going to palpate all 10 of your lymph nodes. I'm going to call them out as I go. Let me know if you feel any tenderness, okay?
Okay.
Preauricular, posterior auricular, occipital, submental, submandibular, jugulodigastric, superficial cervical,
No.
deep cervical,
No.
posterior cervical,
No.
and can you pick both shoulders up for me? Superficial clavicular. All right. Now I'm going to step behind you and we're going to do your thyroid. I'm going to place both hands on your neck. Let me know if you feel any tenderness. Can you tilt your head to one side for me and swallow? All right, now to the other side and swallow. Any tenderness?
No.
All right. All right, that concludes the examination today. Do you have any questions for me?
No, ma'am.
All right, thank you.
Thank you.